St. Francis Hospital is always trying to stay current with new technology. We work closely with industry looking at new devices to help our patients. What we're going to be talking about today is the Impella device. I actually have it here in my hand. We use this device when we do a procedure called an angiogram. An angiogram is a test to look at the heart muscle, the function of the heart, the valves, and the arteries. If you have a blockage in an artery, it limits flow to the muscle. If the artery closes, the muscle dies, and that's what a heart attack is. Our job is to prevent that from happening. And over many years, techniques have been developed, and the most advanced technique is to use a procedure called a stent. A stent is like a little metal spring we put in the artery with a balloon that expands the artery, and the stent keeps the artery open. Historically, when we would do the stents, it's usually people who have good heart function, where the hearts are strong. But there are many people who've had heart attacks and have very weak heart muscle, and that procedure has increased risk. Those people frequently in the past would be sent for bypass surgery or treated medically. We can determine the strength of someone's heart muscle by injecting contrast into the heart and seeing how it pumps. That determines the risk factor associated with that patient and also helps us determine if they're a good candidate for the Impella device. Recently, a catheter was developed called an Impella catheter, which I have here. And this device, we put in the patient's artery and it goes into the heart. This catheter is inserted via a sheath which looks like a straw that we put into an artery called the femoral artery in the groin. And then a little catheter, a plastic tube, so we can put all our catheters through there, and then you won't feel any pain afterwards. And that's the heart part. Catheters in, you won't feel any other pain. We use wires to guide ourselves up through the aorta, which is the major artery of the body, and it connects to the heart, and place this catheter inside the heart. So this is a wire going up into the heart. This part of the catheter actually sits in the heart. This part's in the heart, and this is outside the heart across the aortic valve, which separates the heart from the aorta. And this end of the device is outside the patient, is connected to a pump. And the pump is pumping blood from inside the heart, outside the heart, which is basically what the heart is doing, and this is just assisting its function. And what we're actually doing is, while we're doing a high-risk angioplasty stent procedure, we're giving the patient external support so that we can do these high-risk cases and save them from needing an operation. I mean, these are patients who had to make big decisions. You know, open heart surgery is a big decision for someone to make, especially in the elderly. People who were in the hospital for a week to 10 days with multiple risks, took a long time to recuperate, they were out of work, a lot of discomfort. We're now able to offer these new techniques that are relatively painless for the patient with minimal risk. Effectively, what it's done is it lets us expand the scope of patients that we can treat safely and open up their arteries in a procedure where they go home the next day rather than having to subject them to high-risk bypass surgery. More and more institutions are using them. Obviously, it's only being used in hospitals where angioplasty and stenting is done, and it's only being used in hospitals where there's a high volume, since clinical experience is important. Here at St. Francis, we have one of the largest history of experience with interventionalists, doctors who've been doing this for many, many years at university programs, Ivy League programs around the country. And the years of experience are tremendous here. And the team, from the nurse or the technician working with the doctor, have been working together for years. So it's almost like a ballet. Everybody knows what they're doing, and you have an extraordinary amount of experience with a high success rate in a huge volume in a busy center with tremendous support. Just one, that's it. Now we're just going to put a little closure device in, but we're all done. So St. Francis is actively working, looking for any new technology to stay current and give the best patient care to our patients here in the tri-state area.